You are listening to the Your Knee, Your Health podcast. I'm your host, Adam Rosen. I'm a fellowship-trained, board-certified orthopedic surgeon who specializes in knee replacement. Here I'll talk to you about common knee complaints and other orthopedic issues. We'll cover other important health-related topics, all of which are meant to helpfully answer some of your questions and help improve the quality of your life. Thanks for listening, and on with the next episode. Hello and welcome back. I'm Adam Rosen, and you're listening to the Your Knee, Your Health podcast. In today's episode, I want to talk to you about something that's actually quite simple to do, but something many people forget to do, and that's stretching. So stretching is one of the simplest types of exercises that you can do, and something that may help you in multiple ways, not only just during sports and activities, but also to improve your overall health and well-being, and to increase the flexibility in your muscles throughout your body, which can improve things such as knee function, back pain, and your overall gait. So the most common book that I recommend to patients over and over and over again is a book with a really simple title. The title is Stretching, and it's by a man named Bob Anderson, who is a professional stretch coach. The first edition of this book came out in 1980. I'm not exactly sure which edition I have, but looking now, it looks like it's up to the 30th edition. And this is a book that I strongly recommend to all the patients that I see, whether or not I'm seeing them for knee pain or ankle pain, hip pain, back pain. It's very, very common for people to have tight muscles, and that can really affect multiple problems. So the most common thing that I'll see is if I'm examining somebody with knee pain, and while they're sitting on the examination table, I go to straighten out their knee, or I have them straighten the knee, and they'll reflexively lean back. And the reason that occurs is because their hamstrings are tight. So we've started to live in a world now where a lot of us sit in front of a computer or sit and watch TV. And what happens is when you sit, and if you lean back and recline and you keep your knee bent, the hamstring, which is the series of muscles behind your leg, are fixed into that shortened position. So then when we go to stand, because that muscle has been shortened over and over and over again, it gets tight. And when you stand up and you try to straighten your knee to walk, because that muscle isn't its normal length, it pulls on your pelvis. And what can happen is then the pelvis actually tilts backwards, which can affect your back, and it can affect your gait, and it can affect your hips. So it's a really, really important muscle that I stress to many, many people. And sometimes it's as simple as just sitting on the floor with a towel or a belt around your toes and pulling forward. But for many people, they're always wondering, well, what else can I do? And that's where this book really comes in handy, because by getting this book, a lot of people have the ability to look at the different stretches, and he breaks it down really well. There's a whole introduction about stretching and why stretching is important. And if you go through a lot of the science and data out there, muscle stretching improves the function of the muscle, and it may also prevent injury because you're increasing the elasticity of those muscles, which function to move the joints in your body. But he goes into a lot of the details about the different types of stretches. And, what's really nice is he has different stretches for during the day. So in the morning, while you're walking, in the evening, even just sitting and watching TV, he has different chapters that are specific for those times of the day. So even if someone says, well, yeah, I don't really do much, I just sit in front of the TV all day. Well, congratulations for being honest, but here you go. Here's a whole section on stretches you can do while you sit and watch TV. But also, and specifically for my patients that are a lot more active, is he breaks the stretches down into different activities. So there's a chapter on baseball and softball. There's a chapter on golf, bicycle riding, martial arts, racket sports, skiing, tennis, volleyball, swimming, surfing. So for patients that have a muscle group and they want to stretch that muscle group, I think for a lot of activities, even at the gym or just riding the bike, people get bored and they're not really sure what to do, or you try to explain 10 stretches to them and it's overwhelming. So what's nice is, I have my patients go home and they open up this chapter and it's like, here's a sequence of stretches that you can do for your particular sport or activity, which improves your function and may prevent injury. And what's nice then is if you get bored, even though you may not do the other sport or activity, it's a different sequence of stretches. And what I find is with his stretches, it's probably one of the simplest and easy to understand pictures. But the important thing is using your muscles and using your joints. Again, we get back to arthritis, where a lot of people are afraid that, well, if I have arthritis in my hip or my knee or my shoulder or my elbow, I don't want to do something because I'm afraid I'm going to make it worse or wear it out. And the opposite is the truth, is that you want to move the joint. That cartilage gets its nutrition by you moving the joint. And although we also want to strengthen the muscles that support those joints, we want to keep those muscles flexible. So you can go online and find lots of stretches, but I always tell my patients, if you want to buy one book that you can use for the rest of your life, this book, Stretching by Bob Anderson, is a great book, and I'll go on Amazon. I actually have a link on my own personal website too, but I'll go on Amazon and I'll put that in the show notes if anybody has difficulty finding it. So you can click on the link and it'll take you right to the book, and you can purchase this book, and it gives you a great thing to do at home. And it is important to do regularly. So, I always tell people that, if you go to stretch class once a week, that's great, even if you're there for an hour. The problem is if you don't stretch every day, you're probably going to lose everything that you gain. I mean, just take a look at stretching for 10 minutes. You bend over and touch your toes, or you stretch other muscles in your body, and you start and they're really tight, and then you warm up. And then all of a sudden, by the end of the stretching routine, you're a lot more flexible. Well, now 24 hours later, it's going to be tight again. So it is really important, and you may not have time to put an hour in every day, but let's say you have one long stretch day where you really have the time to dedicate to stretching. That's great. And then every other day, try to find a few minutes. And if it's first thing in the morning or before you go to bed, that's great. But again, the importance is try to put it into your daily routine whenever you can. So, if you're watching TV, find stretches that you can do sitting on the TV or on the sofa, putting your foot up and doing different stretches. And even if you're on the phone, if you have a speakerphone on, or you have, pods in your ears and you're talking that way, you can stand up, get out of the chair and do some stretches. Desks that stand and sit and modify your routine throughout the day are great because you're changing positions. But you may even set a timer if you have a sit-down desk and say, hey, when that timer goes off, I get up and I just do a couple simple stretches just to keep those muscles going throughout the day. So stretching, that's the important thing, something that you want to try to incorporate into your daily activity. There's lots and lots of stretches that you can do for your neck, shoulders, arms, back, legs. So look into different stretches, especially as you progress. You may notice that one particular muscle group is tighter than the others. Most commonly, with people I see, that's the hamstring. Just because of the world that we live in, there's an excessive amount of sitting. But if you notice another group that is tight, just find ways in your day that you can work on that muscle group. And what you may see over a number of weeks and months as you do these regularly is those muscles will stretch out. They become more flexible. They become more functional. It improves the health of those muscles, and it may also help the joints that those muscles cross and support. So enter this into your routine. The book is Stretching by Bob Anderson, and I really encourage you to get started with a program. As with any exercise program, talk to your doctor first and make sure that you don't have a health condition that would be contraindicated to starting this program. And if you have someone that would benefit from this, please forward this information to them, refer them to this podcast. Do them a favor, buy them a present, send a book to them if you're buying one yourself. I'm sure they'll appreciate it. And once again, thanks for listening. I'm Adam Rosen. You've been listening to the Your Knee, Your Health podcast. Thanks for listening to the Your Knee, Your Health podcast. If you've not already done so, please subscribe so you'll be notified of future episodes. And if you enjoy what you're hearing, please take the time to leave a review. It helps other people like you find the show. I'm your host, Adam Rosen, and until next time, stay safe.